Hello, everyone. Welcome to Lakewood Health Systems Well Videocast. My name is Matt Jensen, Director of Marketing at Lakewood. Today, we're going to be talking about two new ear, nose, and throat procedures that are currently being offered at Lakewood Health System. And here today to discuss these with me, Dr. Ted Truitt. He is a visiting ENT specialist at Lakewood. He's with St. Cloud Ear, Nose, and Throat, and he currently sees patients at Lakewood's Staples and Pillager clinics every Thursday. Dr. Truitt, thank you so much for joining me today.
Thanks for having me, Matt.
Great to have you with me, Ted. So first question for you today. The first procedure I want to ask you about today. There's a procedure out there that I know a lot of parents are going to be super excited about. You've been doing this for over a year now. It has to do with the insertion of ear tubes into kids and those nasty ear infections that we all tend to deal with. So that procedure is called the Hummingbird Procedure. You want to tell us a little bit about that today, Dr. Truitt?
Well, kids have been getting ear infections for as far back as we can remember, and the way we've always treated kids that get ear infections is antibiotics. If antibiotics don't work, then we talk about doing tubes. And really, all tubes it's just a way to ventilate that middle ear space. We all have a eustachian tube that connects our nose to the middle ear, and that helps keep air in the middle ear space. By ventilating that space with the eustachian tube, we're able to prevent ear infections and prevent fluid from getting into that space. Whether it's colds or allergies, or bad luck or whatever, then that will start filling up with fluid and we'll have problems. So by putting a tube into that space, it bypasses the eustachian tube, and then ear infections are prevented. So the way we've always done it is under general anesthesia. So a child goes into the operating room, breathes in a gas that puts them to sleep. They're asleep for, about 5 to 10 minutes, but it usually takes them a good half hour to an hour to wake up, and they're crying the whole time. And they go home the same day, and usually in a few hours, they're doing really well. Well, the question was asked about 5 years ago is, do we really need to put all these kids to sleep? Where you could have a 12-year-old or a 15-year-old or any adult that has eustachian tube problems, where we can actually put the tube in the office. So what the Hummingbird procedure does, it's a one-pass system where we can numb the eardrum up in an office-like setting or a procedure room, and without any anesthesia, without having to worry about eating or drinking after midnight. We can numb the eardrum up, use this Hummingbird device to go through the eardrum and drop a tube in. And it takes about 2 seconds to do that. And then we can do both ears really pretty quick. And the child cries usually only during the procedure because they don't like their ear being looked at or messed with at all. But it's not really because of pain. They will go home without being in pain, and they're pretty much back to normal within minutes after leaving.
What an amazing advance. I know all three of my kids had ear tubes. They're big now, so I certainly don't have that problem anymore, but I know it created a lot of anxiety, not only for us, but for the kids, and it's a stressful thing having to put them under that anesthesia. And so what a great advancement in terms of being able to avoid all of that. So thank you for letting us know about that one, Dr. Truitt. Second question I have for you today is, and this one, I know I've also got a friend who has, and we're going to talk about this in a second, that nasal drip that, especially during the winter time, and I know there's another procedure that can kind of take care of that. This procedure is called Clarifix. So take a second to tell us about this procedure as well.
Well, this procedure, it's a brand new procedure that's out. And I should first kind of explain why we'd even use this procedure. I mean, we've got a lot of people that suffer from allergies, and a lot of people that have what's called vasomotor rhinitis, is where their nose reacts too much to the environment. It's not an allergy, it's just like a weather change or whatever. And then as we get older, sometimes the nose just plain drips and you can't get it to stop dripping. And so what we do is we treat with allergy meds, nasal sprays and all that. And sometimes they work pretty well, but not great, or they don't work at all. And then people just get frustrated. The patient's obviously frustrated, the doctor's frustrated. But what this procedure is that I'm really excited about, and and just really hoping to treat a lot of patients up in the Staples area is it's Clarifix, and there's a way to freeze the nerve that comes into the nose. Now, you'd say, well, why freeze the nerve? The nerve that we're looking at treating is innervating the mucosa. It's kind of like the skin inside the nose. And when that's working and stimulating, it will cause congestion and drainage. Now, that's a parasympathetic nerve, and then there's sympathetic nerves. And without getting too scientific, there's an overaction of the parasympathetics. And if we can get that to calm down, then that will relatively dry up the nose so that my patients aren't needing to use Kleenex, blow their nose a lot, don't feel like they're always walking around congested. And so by applying some liquid nitrogen right up to where the nerve is, we can, in the office, treat it without any discomfort, without removing any tissue, without causing bleeding, and that we can make a long-term success, improvement in these symptoms that have been so hard to treat for so long for patients that have basically given up on their nose.
Interesting. So could you tell me a little bit also, Dr. Truitt, about how long does the procedure take, and any sort of side effects that might be associated with it that you can inform the patients about today?
The procedure takes about 20 minutes, and it's all done in the office. We will numb the nose up, we'll decongest it, and the patient's totally comfortable. We treat the nose, and the patient goes home shortly after. The side effects is pretty much a headache that can happen in the first hour or two after. I think a lot of patients that would fall into that group just say it's a really intense kind of ice cream type headache. And I explain it to my patients ahead of time. They don't feel it during the procedure, but when it's over, I have them drink some tea and just kind of hang out, and eventually it goes away. It's not a long-lasting discomfort. That's about 10% of patients, and I found that it really does. It doesn't happen that often, and if with just the numbing process that we use, it's pretty unusual to get it. Bleeding is extremely uncommon with this. To get the nose to be too dry would be unusual as well, but those are risks that I'll talk to a patient about. It's really not a risky thing, and it's really best done under local anesthesia.
All right, so minimal side effects and really very little time spent in the clinic in terms of the actual procedure itself. It sounds like a wonderful option for patients. Dr. Truitt, if you could remind us what days you are up in the Staples area, and then I also understand you have another associate from St. Cloud Ear, Nose, and Throat that's going to be joining you and doing some days up in Staples as well. So could you tell us a little bit more about that?
I come to Staples Hospital every Thursday for the most part. I have a partner, Dr. Amy Deerking, who comes to Pillager every other week on a different day of the week. You would just call to make an appointment at either location. And the Hummingbird procedure is a newer procedure that I do mostly, but the Clarifix procedure, Dr. Deerking would know plenty about that.
All right, thank you, Dr. Truitt. And for patients out there who might be interested in this, that want to look into it, sit down and have a conversation with you about it, they can go ahead and call 320-252-0233 and set up an appointment with you or your associate, Dr. Deerking, and in Staples or Pillager, and get that set up. So, Dr. Truitt, thank you so much for spending time with me today.
Oh, thanks for having me, Matt.